Assalamualaikum and hi. My name is Nur Aimah Sarah binti Muhammad Zohai Nizam. Can call me Ain. My normative is 86772. We are from Group 6. Group 6 is do assignment about the nurse. Our topic is how nurse manage and cope with their challenges as a nurse. Our member group is Victoria as the leader, Jessica, me, Azlin, Hanim, Sakina, Rona, Sarah dan Zarifah.
On the abstract, this study aims to identify the experiences of nurses and their responsibility as caregivers for patients in hospitals. This research is only to look into the life of the nurses that were interviewed as individuals and does not represent all nurses. The themes that were chosen for the study addresses the issue that nurses have, so people will better understand them through the qualitative approach as the method of research. 5 nurses were interviewed by each subgroup within the group in order to retrieve info regarding them. This study focuses on the nurses' experiences in dealing with their occupation on an almost daily basis. The findings indicated that for nurses, changes, especially time management, was the most stressful experience, followed by mental health and work satisfaction level.
Next, I will present introduction. As we know, nurse is a person who is been trained to provide care for the sick or infirm people, particularly in hospital. Nurse also satisfies the established educational standard and clinical abilities. According to Johnston MJ 2004, nurse are one of the healthcare professional and employees who are in charge of providing care to client and patient in accordance with ethical consideration. They also provide services that are essential and useful for improving, maintaining, and restoring health and survival. For all of you information, our group interviewed nurses to learn about the profession of a nurse, and we also asked several questions regarding their work.
Moving to the next slide, let's talk about theory. In this case study, we use 2 theory, which is Erikson's humanist theory and Freud psychosexual theory. Okay, Erikson humanist theory of psychosocial development differs significantly from a traditional Freudian psychosexual theory of human development in 2 ways. Erikson believed that human personality continue to develop past the age of 5, and he believed that development of personality depends directly on the resolution of existing crises like trust, autonomy, intimacy, individuality, integration, and identity, which are viewed in traditional psychoanalytic theory as mere byproduct of resolution of sexual crisis. As a nursing for a various field, they need a skill in socializing from every age of regardless of race and religion. This skill can make it easier for them to get to know the patient more deeply. This is because every age show its development. In addition, his theory emphasizing the significance of relationship, culture influence, and social molding one's psychosocial development in emphasizing the interact between individual and social element. It's offer a true framework of comprehending the difficult and the change of people face at the various phase of life. Although Freud either can prove insight into some element of nursing, while Freud believed that personality is formed only in childhood, but Erikson suggests that the personality develop occur through life. Erikson suggests the way we interact with others is the what affect our sense of self, or what is called ego identity. That's all for me.
In this study, our group used an interview method from the 5 nurses to get some information that need in this research. By using this method, it may help us to understand more about their information and get response through face-to-face and online. we ask some questions that we need to relate to our research. For the first, second, third, and fourth nurses, we use an online method to interview them. Meanwhile, for the fifth nurse, we use a face-to-face method to interview her. We are very pleased that all respondents can cooperate very well to help us in this research.
Jururawat yang pertama adalah Muhammad Nadir bin Mustafa. Beliau juga berusia 30 tahun dan bekerja di Hospital Besar Melaka. Beliau juga sudah berkahwin. Cabaran sebagai jururawat dari segi pengurusan masa, beliau menyatakan bahawa beliau sering mengalami masalah dalam pengurusan masa disebabkan pekerjaan sebagai nurse mempunyai shift dan tidak sama macam pejabat. Beliau juga turut menyatakan bahawa beliau jarang meluangkan masa pada hari Sabtu dan Ahad bersama keluarga disebabkan perlu bekerja. Seterusnya, bahagian pengurusan wang, beliau menyatakan bahawa tiada masalah kerana gajinya mencukupi dan beliau juga bekerja sebagai nurse dan berkelulusan diploma bahagian nursing. Seterusnya adalah pengalaman pertama kali bekerja sebagai jururawat adalah beliau menyatakan pada awal bekerja, beliau merasa sedikit mencabar kerana perlu berhadapan dengan pesakit yang betul. Bila berhadapan dengan kes kematian, awalnya beliau selalu terkejut dan lama kelamaan menjadi biasa. Beliau juga turut menyatakan bahawa doktor juga sering membantu jururawat dan jururawat juga selalu membantu doktor semasa berhadapan dengan pesakit. Seterusnya, kesan kepada beliau selepas bekerja sebagai jururawat. Dari segi fizikal, beliau tahu menjaga pemakanan dan beliau dapat membezakan apa yang boleh dimakan dan apa yang tidak boleh dimakan bagi sesuatu penyakit yang dialami. Yang kedua adalah dari segi mental, beliau tahu membezakan mana yang baik dan mana yang tak baik dan beliau boleh memberi nasihat dan penerangan kepada keluarga berkaitan penyakit yang mereka alami. Beliau juga menyatakan bahawa keluarganya boleh bertanya apa yang mereka tidak tahu dan ingin tahu kepada beliau. Menurut beliau, ini adalah kelebihan menjadi nurse. Seterusnya, rutin harian. Bagi beliau, rutin hariannya tidak banyak berubah. Cuma bagi beliau telah mendapat lebih ilmu dari segi penjagaan makanan. Dan beliau juga dapat memberi nasihat kepada keluarganya berkaitan makanan kesihatan. Seterusnya, bagi kategori hubungan sosial. Hubungan bersama ibu bapa. Hubungan beliau dengan ibu bapanya sangat baik. Beliau turut berkongsi bahawa ibu bapanya susah untuk pergi ke hospital. Jadinya, beliau berasa bertuah kerana bekerja sebagai nurse kerana beliau dapat mengesan jika ibu bapanya tidak sihat dan boleh segera ke hospital. Hal ini dapat membantu mengelakkan penyakit menjadi teruk dan dapat dihindari awal. Seterusnya, hubungan dengan rakan sekerja. Hubungan beliau dengan rakan sekerja baik kerana mereka perlukan antara satu sama lain dan perlukan kerjasama dengan rakan sekerja. Hubungan dengan pesakit adalah beliau perlu menjaga hubungan dengan pesakit kerana beliau selalu berhadapan dengan pesakit. Beliau juga perlu menjaga hubungan dengan pesakit supaya kerja berjalan dengan lancar dan pesakit dapat memberitahu apa-apa masalah kepada nurse. Hubungan dengan pihak atasan, beliau amatlah menjaga hubungan dengan doktor kerana nurse selalu akan bekerjasama dengan doktor. Seterusnya tahap kepuasan pekerjaan. Dari segi kemudahan infrastruktur yang disediakan di Hospital Melaka, beliau menyatakan baik dan memuaskan. Dan ada hospital yang lebih bagus lagi daripada Hospital Melaka seperti di Hospital Kuala Lumpur. Di Hospital Kuala Lumpur mempunyai kepakaran berkaitan dengan neurosurgery, otak dan darah beku. Tetapi di Melaka tiada kerana tidak mempunyai kepakaran dalam bidang tersebut. Kedua adalah dari segi gaji. Bagi beliau tiada masalah Dan beliau juga turut berkongsi bahawa ada staf yang akan bekerja lebih masa di hospital kerana perlu wang yang lebih. Dari segi masa pula, beliau menyatakan bahawa petang dan malam adalah waktu untuk keluarga. Jika cuti pada waktu petang dan malam, itu adalah waktu beliau dapat spend time dengan family. Kaunseling untuk jururawat. Beliau menyatakan bahawa beliau tidak pernah mengikuti ataupun menghadiri kaunseling sepanjang menjadi jururawat. Jika ada masalah, beliau kemungkinan akan mengikuti kaunseling.
Okay, now we move to the next nurse that we have interviewed for this assignment, which is Puan Rosna binti Osman. Puan Rosna binti Osman was a pediatric nurse to mother and children in Klinik Desa Bawing, Petas Sabah. She was 49 years old this year and was a mother to 2 children. She got his diploma in nursing at College Kejururawatan Kemasyarakatan Tawau, Sabah. Okay, now we move to the question that we have asked Puan Rosna during the interview. For the first term, which is challenges as a nurse. In terms of the time management, Puan Rosna binti Osman said that sometimes she needs to work overtime even if it's weekends, no matter Sunday or Saturday. And sometimes she also have to attend extra shift, and this lead her to rarely has time to spend with her loved ones and also have no time for herself. But Puan Rosna does understand that it was her responsibility to sacrifice their time in order to help those in need. In terms of the money management, Puan Rosna said that there are no problems with the salary, but if there are financial problems that happen, it is because of herself. Now we move to her challenges when working as a nurse for the first time. When she first works as a nurse, Puan Rosna said that she needs to accept the fact that she needs to be far away from her family. She needs to be separated from her family as she was assigned to work in another clinic in another district, which is in the interior of Petas Sabah. So she does face challenge as she needs time to learn their culture in order to build the trust and relationship with the people over there. Now we move to the next term, which is affects working as a nurse. In terms of physically, Puan Rosna said that it does affect her physically, but she realized that it was her responsibility, so she needs to face it for the best of people over there. And mentally, it does affect her mentally too, to be assigned to work in a place far from her family, and she rarely meets her family. So she need to face it as she knows it was her responsibility to help those people in it over there. In terms of her daily routine, it does affect her daily routine too, as she has limited time to spend with her family, because sometimes she may be called to work even on holidays, no matter what day. Okay, now for the third term, which is her social relationship. Her relationship with her parents are very good, but they do support her to work as a nurse. In terms of her relationship with her co-worker, she does get along with them well. She has a good relationship with her co-workers as they are working together. They do understand each other and support each other. In terms of her relationship with the patients, she did get along well with all her patients as it was her responsibility, so she needs to try to understand her patients, try to build the trust between both of them so that they can cooperate well in order to find the cure for the sickness they may experience. And in terms of her relationship with the higher ups, especially doctor and director, Puan Rosna said that they can work with each other very well, so she literally had no problems with the doctors and the other higher ups. For the fourth term, in the question that we have asked Puan Rosna is work satisfaction level. Puan Rosna said that she does not that satisfied with the infrastructure facility in her workplace because there is a lack of staff and tools to help the patient and transportation because she works in a clinic in the interior of Pitasaba, so it was a bit hard for her. In terms of salary, Puan Rosna said that she has no problem with the salary and overall she was satisfied with it. And for time, she does not that satisfied with her time, but she does accept it with open heart and open mind. She rarely spends her time with her family as she works far from home, and she only spends time with them on a day off. Okay, for the last time is for counseling for nurse. Before we end the interview, I have asked Puan Rosna if she have ever attended a counseling session before. But Puan Rosna said that she have never attended a counseling session before, but she may attend it if she had a chance. I also asked how does he handle her problem if she had never attended a counseling session before. Puan Rosna said that she sometimes handled it by herself, but if it was too much for him to handle it herself, she tried to find someone he trusts to lean on, to listen, to make her feel calm. Okay, that's all for.
Greetings, my name is Sarah Debra Di Silva. My metric number is 86969, and today I will be presenting for our third nurse, which is Madam Priscilla Francis. She is 48 years old and has been working as a nurse for 25 years. Her higher education is diploma in nursing and is currently serving at Maternal and Child Health Clinic at Kota Kinabalu. The challenges that Madam Priscilla has faced while working as a nurse, the first one is in terms of her time management. She mentioned that she has no issues with her time management as she is well at managing them. She has been disciplining herself since she was a junior nurse, so she has managed to manage her time well. In terms of money management, she mentioned that her salary is enough, so she has no problems with her money management. Meanwhile, as for her first experience as a nurse, she mentioned that the responsibility of working as a nurse, as a practical nurse and as a real nurse were very different, so it was quite hard for her and it made her feel nervous working as her nurse at first. But over the years, with the help of her seniors, she was able to adapt to her work environment and her work ethics. In our interview with Madam Priscilla, we've also asked her about the effects of working as a nurse on her physical, mental, and on her daily routine. As for her physical, she was feeling drained most of the time because the number of the staff outweighs the number of the patients. So she felt her body felt very tired most of the time. As for her mental health, as her body gets tired, her mental gets tired too. And as of her daily routine, she has no problem with her daily routine as her duty is during office hour. She was able to spend time with her family during the weekends. And as for her social relationships, as working as a nurse, her relationship with her parents were very well, but she felt very sad to be living away from them. And as for her colleagues, she had a hard time getting along with some of her juniors, because sometimes when she advised her juniors, they would give a negative feedback or negative response. Nevertheless, she tried to keep a positive attitude and be a good example to her colleagues. The third one is her patients. So far, her social relationship with her patient is quite well. She never get any complaints from her patients. The last one is her relationship with the higher ups, such as doctor and director. Her relationship with the higher ups are fine. She never had any conflicts or disagreements with them. For the fourth team, which is her work satisfaction level working as a nurse, in terms of infrastructure level, the clinic where she is working now, the Maternal and Child Health Clinic, the building is quite old, but there has been some improvement from time to time, so she is very satisfied with the working tools, the medication tools, and the facility at her clinic. For her salary, she mentioned that her salary was enough for her, and she is very grateful for what she has now. The third one is in terms of her work satisfaction level for her time. She is very satisfied with her work time because as she is getting older, she wants to spend more time with her children. So she was very happy. She was working on office hour as she has some free time on weekends. So she was able to spend time with her family more on weekends. For the last team, which is counseling for nurses, our nurse, Madam Priscilla, mentioned she never attended any counseling session before, but she was interested to know and to learn more about counseling for nurses because she believed that counseling for nurses, getting the knowledge for it, she will be able to help not only herself, her staff, but also her patients with the knowledge of counseling. As for the ongoing conflict, whether physical or mental, although she is exhausted, she stated that she is okay and not in any need of help from professional mentally or physically. The next one is emotional disorder. She has none as of yet. She's doing fine and she remains rational at the moment. For the last one, for the problems that she's dealing currently as a nurse, she admitted that she had some problems. She had some problems with her colleagues, but they weren't to the extent that she needed to attend counseling session. Her problems are still manageable and can be solved. She said that the problems can be solved through communication and comprehension with her colleagues.
Next nurse is Puan Nur Hidayah binti Muhammad Kahal. She is 36 years old. She has diploma in nursing and now she works as pediatric nurse. She married after 3 months, finished her diploma in nursing. After that, we asked her challenge as a nurse, especially about time management, her first experience as a nurse, and her money management. First, she said she has no problem with her time management because she has husband beside her, so she have someone to help her to manage everything. She also able to adapt well with her work shift because she had worked for 15 years. She also mentioned that she has not have problem with her financial issue. Then, she told that her first experience working at children's section is quite challenging because she not only deal with patients, but she deal with their guardians who are always asking every single action that they do to treat the patient. But she also grateful because the children easy to deal.
The next question we ask is, what the effect of working as a nurse in her mental, physical and daily routine? Even though working as a nurse is a tough job, but Puan Hidayah never let it take control of her mental and health. Puan Hidayah always considering taking any profession with a uniform, and now she's become a nurse, and which is make her mentally prepared for taking this job. She really takes this job seriously and with responsibility since they are playing with someone's life. For physical effect, she did lose some weight due to stress in early phase of her career. After a few years, she gained back her weight due to some circumstances that make her extremely happy. After a few years, she successfully coping with the job stress and she able to participate in the hospital activity and also the club activity she joined. Because of that, she is starting to lose some weight in a healthy way and reach her ideal weight. According to Puan Hidayah, she never has a problem with her daily routine. She can arrange everything well because her husband really understands her profession needed. Not only her husband, but also the babysitter of their children also cooperate with her well. It makes Puan Hidayah have a flexible daily routine even when there is emergency on-call situation. Both her husband and babysitter can cooperate with her perfectly well. The next important thing in working life is a social relationship, both in her parents and parents-in-law have a good relationship with her. They also understand if she cannot apply for leave for holidays such as Hari Raya, because her husband also has the same problem. The communication between them still going smoothly fine for this entire time. For her colleagues, they indeed sometimes have a little argument about the work shift and leave requests, which is a normal situation when we are on working life. But for so far, they are getting well together. With the patient, she is able to maintain a good relationship with them. Puan Hidayah especially like it when some kids choose her to treat them even though she is not the one who is in charge of them. Same as the other, the relationship between Puan Hidayah and her higher-ups is good. They really take care of their workers. We cannot deny that the work satisfaction level can affect the quality of a person's work. In terms of infrastructure, Puan Hidayah is very satisfied with it. The quarters that she lives in now are in good condition. In addition, the quarters are also close to her and her husband's workplace and also close to her children's schools. The transportation here at Taiping is easy to access too. How about salary? She was satisfied with her old salary already, and because of she had already worked for 15 years, the rise she's got now also made her extra satisfied with it. As we said before, Puan Hidayah is happy with her working hour because she able to spend time with her family and her husband, and thanks to the help of her babysitter also. Thanks to all the factors, she can manage her time perfectly well. As we can see, Puan Hidayah can handle all her problems so well. She does not have a serious problem related to her emotion or any ongoing problem that she cannot handle. As a result, she does not need to attend any counseling session. She had met with a counselor, but that was related to the patient she dealt with and not related to herself.
Hi, about this discussion about the demography nurse, I would like to share about Puan Nurahan binti Musta. She is the gender is female, obviously is female. About the age, she is 31 years old. She nurse in the baby ward. Status, she is already married. Also about the academic, about the level education in diploma nursing. The team 1 is about challenging as a nurse. We have 3 points in one team. Is firstly time management, secondly money management, and thirdly experience first time working. Okay, we talk about the first point, time management. She tells she doesn't have difficulty with the time because she didn't have a family yet. That means she no have a child yet. So about the time with her husband is not difficult team to manage. Secondly, about the money management, she tell about the salary as a nurse is enough to 1 month. So it's not be difficult thing to her or challenging about the salary. Third point about first time working, Puan Raihan, she tell she very nervous lah as the first time work, and also she faced with the patient is not listen to her. So this is the difficult thing to her explain to patient to listen what she advise, and also about the family patient. The family patient also is always complain how the nurse are working. We go to teams 2 about the effect working as a nurse. We have 3 also point. Firstly, physical. Secondly, mentally, and third, daily routine. We go to first point is physically. In physically, Puan Rahan doesn't not feel tired in the nursing service to the baby. What? Because she is very kind and orderly. In the ward baby, she only focus on take care of the baby first, and the secondly, she focus on the baby mothers. We go to point 2, mentally. In the mentally, she doesn't have a mental illness because if the job she says she happy in life job with me a great team to collaborate together. She enjoy her job because she have a staff that understand each other. She doesn't have a problem about the time of work because the sister of the nurse understand what kind of the situation happen in Puan Rahan. We go the third point. In daily routine, Puan Rahan doesn't have a problem with daily life because he can manage her time with her and her husband. Moreover, she doesn't have a child right now, so he can manage her time with the shift. We go to team 3 about the social relationship. We have 3 points. Firstly, parents. Secondly, patient. Thirdly, higher up. About the parents, Puan Rahan has a good relationship with her parents and family-in-law. Her family can understand her scope and job because when Hari Raya Aidilfitri, she rarely can take a holiday to celebrate. We go to second point, patient. Relationship with the patient, she no have a problem handling the baby and the mother's baby. The problem is communication with their patient family lah. Thirdly, higher up. Puan Rahan had no problem with the higher up and also the doctor. They collaborate with each other professionally. She have a team that can talk at the one table. We go to team 4. Words certification. We have 3 points also. 1, infrastructure facility. 2, salary, and 3 time. About the infrastructure facility, in the facility we have a quarters for a nurse, but she decide to stay with her husband because her husband also have a quarters. Secondly, about the salary, she doesn't have a problem because the salary is enough for 1 month. With that salary, he can survive. Thirdly, about the time, he can manage the time properly. She doesn't have a children, so she concentrate more to works and her husband. She doesn't have problem with time in daily life. We go to team 5 about the counseling for session. When I interview her, Puan Rahan never attend the counseling session because as of today, she has no major problem related to mental health. She enjoy with the cook and their job and her jobs. So in my opinion, she can handle the problem, can solving their problem with not using the counselor. Last but not least, we go to conclusion. The research offer more detail about the life of person working under a professional, which is a nurse, that involve challenging that vary according to the environment. Moreover, the works involve people coming from various backgrounds, expertise in socializing in all age in entice a nurse. Besides that, the interest to help people also need to nurture in oneself, even if one has to satisfy one's own time. Their mental health also need to take care of because based on the information we have, often many of these nurses have never attended a counseling session and they are interested in attend session if given the opportunity. People may see the professional of nurse as ordinary and not as good as a doctor, but they are the backbone of a doctor. That's all from my group. I hope this knowledge can be used to our other research and also to give other knowledge to students also. Thank you for your attention. Then see you all next week. Bye.